Accessing primary care is one of the biggest challenges in BC, and most British Columbians know how frustrating it is to find family doctor. Avee Health is working to fix that. I'm here with Dr. Howard Kosef, Medical Director of Avee Health. It's a pleasure to meet you. Thank you for being here with me.
Thank you so much, Hediye. Lovely to be here with you today as well.
Thank you. So let me start by saying I am super excited to see this because I've spent the majority of my career in healthcare for 20 years. And I know firsthand how challenging it is for people to have a family doctor. This is a big problem in British Columbia, people waiting weeks to be seen. And then once they see a doctor, they only have a few minutes because they can only ask one question. And then they have to wait another few weeks to ask the second question. So it's a huge, huge challenge. I'm super excited to see there are platforms like this coming. I'm a super fan of what Avee is trying to solve here. So I want to hear from you. What is Avee is all about?
Avee Health has been around for about 5 years. And what we're about is, well, initially we were founded because there is supposed to be about a 20% of the BC population do not have family doctors. So that's about anywhere between 750,000 and 1 million British Columbians who are unattached.
That is crazy.
Huge number.
Huge.
And so originally, Avee started as a platform where pharmacists could introduce patients of theirs to Avee to access medical care. Over the years, we've grown, and we now offer patients the ability to access us directly themselves as well. And what our focus is fast, efficient, easy, and essentially hassle-free access to a doctor quickly.
So how fast does it take to see from the moment a patient finds you guys to a moment they're connected with a doctor?
Great question. So a patient can literally go to our website and request an appointment with a doctor, and the average wait time is 2.5 hours. Let me say that again. We're talking hours. So accessibility is one of the main things that we've really focused on. So if you want to see a doctor today, you can.
And this is available to everybody in British Columbia.
This is available to every BC resident, and it is a service that is free of charge. It is covered by Medical Services Plan of Canada.
Amazing. This is where technology has come to. It's so amazing to see solutions like this. I was reading somewhere in the latest survey that the average wait time in walk-in clinics generally is about an hour and a half. And then you're rushed and you only have a few minutes because of the demand. And as you said, a lot of these people don't even have a family doctor. So it's going from one walk-in clinic to another walk-in clinic, answering one question at a time, and then it's crazy. So now I was looking at the Avee Health, and I was very pleased to see how technology friendly it is for anyone just to go to a website, not having to download an app, which is not what everybody want to do because we have so many apps on our phone now. With a click of a button, you can book an appointment, no forms to fill. And I was really happy to see the next available appointment is, 2 hours from now, which you can obviously get a same-day visit. How many people do you think in British Columbia know about this?
Oh, it's a good question. I can tell you that we're now seeing about on average 1,000 patients a day.
Amazing.
So, and we're growing fast. When people hear about us, they love our service and they come back. They bring their family members, they bring their friends. And so we are growing. there is demand.
Amazing. So the speed is there, which is the biggest problem. Everybody in British Columbia is waiting, obviously. A lot of people not having a family doctor and having to wait weeks to be seen. And now with a technology like this, with a click of a button, they can book an appointment. What about quality? Because a lot of people say, well, if I'm going to be seen online, am I going to be rushed? How is the quality going to be this? What is it? What about the kind of continuity of care? Like, how would you address those concerns?
Very good question. So I can tell you that our physicians are vetted. We also have nurse practitioners who are on our platform, and we strive to offer patient-focused care.
Mhm.
So, I mean, one of the issues with all encounters in the province is the doctor is paid a set fee, and the doctor has to. It has to be win-win on both sides. Everybody has a slightly different approach, and so ideally, what you do on our platform is you find a doctor who you have a good rapport with,
Mhm.
and then you can keep on going back to that same doctor. If that doctor isn't available, you can go back to another doctor, another physician who's available sooner.
How many doctors currently you have on the platform?
We have about 70 active physicians, each working shifts at their own control. So whenever they want to see patients, they're available to select times that they'll see patients,
Mhm.
and then they'll be open for business.
Which brings me to my next question. I also saw there's a patient side, there's a doctor side, and there's a pharmacy side. So obviously, the more doctors on this platform, the more accessible it will be. So is it open to if there are doctors in BC that are available outside of their regular practice, can they come sign up on Avee and see more patients?
Absolutely. So the beauty of the Avee platform for physicians is that the physician gets to control the amount of work, when and where they want to work, how often, how long. Another issue is that it's a super easy platform to onboard. Physicians literally are given a 90-minute session, and then within a few days they can be working.
How is that helping? How is this platform helping their practice easier?
So, times are interesting. People need to work a little bit harder. People need to work a little bit smarter.
Mhm.
And so physicians can say to themselves, I've got a few hours on these and these days. I can see patients. I don't have to go to an office to see patients.
So
And
you
so,
literally be on vacation as a doctor, log in, see a few patients, right?
well, if that was your preference, yes, but they can be at home, they can be in a quiet place somewhere else and see patients. Absolutely. The other thing is we have a very reliable patient flow, so it's good for doctors to sign on because if they open up a slot, they'll get it filled with a patient.
Mhm.
And doctors on our platform don't really have to worry about administration. They don't have to worry about billing. There's no hassles there. And again, there's no commitment. They can work 1 hour a day, they can work 6 hours a day.
Wonderful. It's all supply and demand, right? So the more
Yeah,
doctors, the more patients can be seen. And right now, it seems like there's a lot of patients that don't know where to go. We have amazing platforms like this, and there are still a lot of people don't know about it. That's why I was super excited to talk to you and get more information and get this known to people because there are people struggling to find people, to find doctors, and huge wait times. And by the time you get seen, sometimes it's too late. We're talking about our health, and it's a real crisis. And any solution that can help people find the right care at the right time, before it's too late, is helpful. So the more
right.
doctors know about this, to come on the platform, the more people that can see these doctors, the better for
Absolutely.
everyone.
Absolutely.
And what about the pharmacy side? What does the pharmacy? site?
Okay, so interestingly, Avee started as a pharmacy referral platform,
Hmm.
and we have about 40% of all the pharmacies are aligned. The 40% of the pharmacies in British Columbia are aligned with Avee, and so if they have a patient who they feel needs a medical appointment, they can book the appointment for the patient when the patient is either in their store or on a call with the pharmacist. And the benefit for the pharmacies is that we help them uh, retain customers. If their customers are getting well serviced at their pharmacies with easy access to physicians, I mean, that's a big win. The other thing is that our software is easy for them to use, and
Hmm.
if they need to speak to a physician about a prescription, it's using our software, which is absolutely fantastic. They don't have to phone a doctor's office and wait for the secretary and then be told, okay, the doctor will call you later. It can be almost instantaneous, which is really fantastic for saving time for pharmacists.
Super effective. So essentially, the pharmacy is the primary hub of care where patients come to and they can get their answer from a doctor and get their prescription at the same time, right?
Yes, so they would book an appointment, they'd speak with a physician, and the physician would then send the prescription to the pharmacy.
Whereas before that we had to wait for weeks to see a doctor,
Right.
then go to a pharmacy and wait for hours for the prescription to get ready.
That's
Everything can be done
that's
instantly.
absolutely correct. Yeah. So obviously time is key here for everybody concerned, for patients, for pharmacists, and for doctors.
And there's a lot of, I speak for myself, a lot of busy professionals and people that are in remote communities that have difficulty accessing, either doctor or family physicians or even pharmacy. So having online solutions like this is super, super helpful. Now, Dr. Kosov, how is this platform different from other platforms that are coming up or already exist? Because of this crisis, there are now different solutions coming, and everybody are different. So I want people to understand how is this unique and different from everything else out there?
Okay, so we're an online health, a telehealth platform. I would say that the key for us is, as you mentioned before, the simplicity of use. You go to our website, you register, you ask for an appointment, and you get seen. So accessibility for every British Columbian and speed of access. Those are our two sort of key focuses. Plus, we like to think of ourselves as very efficient, very convenient, and patient-centered. We want to focus on patients. So the patient will say to the platform, we'll ask them, what is the reason for your visit? And then it's there front and center for the physician and patient to deal with an issue.
So walk me through how a patient experience would look like from the moment, let's say for anybody who's listening to this, they find about Avee Health and they go to the website, they click a button to make an appointment, and what happens next?
Okay, so they click an appointment at a given time.
Mhm.
What will happen is they'll receive a text to confirm and remind them that this is when the call is going to happen. At the time, let's say 2.5 hours later, or maybe 2 hours or even less,
Mhm.
a physician will call the number that they've put on the website. And the physician will introduce themselves, and then you're speaking to a doctor. It is literally that simple.
And you can get a prescription refill or any kind of episodic care or anything that's bothering you, and the physician will send the prescription to the pharmacy of your choice right away. And
Your choice. Exactly. Straight away. It's seamless. The pharmacy usually gets the prescription via fax within a few minutes.
Mhm.
And I'm glad you asked that. So we do prescription refills. We can diagnose and manage certain conditions that are sort of conducive over a telephone call.
Mhm.
Um, Maybe just to make sure that the public understands that not every sort of symptom or symptom grouping is amenable to a telephone conversation. Sometimes a physician has to do an examination.
Mhm.
But outside of the occasions where a physician has to do an examination, our physicians not only diagnose and treat, but they also do prescriptions. As I said, we can order blood tests, so labs and investigations. We can order x-rays, ultrasounds, CAT scans, MRIs, other specialty tests, and we do referrals as well to specialists. So it's a fairly large scale of healthcare.
Would the physicians on Avee report to if you have a family doctor? So is the information shared with other health centers or family doctors if required?
Yes. So if a patient has a family doctor and they want a copy of the note, we make sure that they get it.
And is there a patient portal that you can keep a history of who are the previous doctors you've seen or previous appointments you've had?
Okay, so we use an electronic medical record, an EMR, and every interaction with patients is recorded on that EMR. So that even if a patient were to see a different physician afterwards, the history of their interaction previously is noted, and all the medications used were noted. So that is how medicine works today.
And is there a way for patients to pick who they want to see in terms of, um, is there a bio about the different doctors that are on Avee? And if, let's say, if I'm a woman and I want to talk about women's health and I want a doctor that I can relate with the most, or let's say someone is going through like menopause or whatever symptoms that they're comfortable talking to someone with more interest in that area. Is there a bio of each doctor that they can go
Yes,
through and pick?
absolutely. There's a bio, there's a photo of the physician, so patients can look at the physicians available and choose whomever they want to see.
Amazing. Can you share with us a patient story or a success story or case scenario that Avee has helped with?
There are many, but I'll give you one that comes to mind that happened fairly recently.
Mhm.
We had an unattached patient who had a problem of shortness of breath.
Mhm.
She complained to a physician that she was having this problem for a few months. The physician ordered a chest X-ray. The chest X-ray came back with some question marks. So the same physician ordered a CAT scan on our patient.
Mhm.
This was done literally within a few weeks. We managed to get the CAT scan because it was assessed as urgent. The CAT scan came back showing a problem. And when the patient wanted to see that same physician again, that physician was away. They spoke to me instead. I saw what the problem was, and I managed to organize a biopsy of the lung, which is not easy to do. And that patient had that lung biopsy a week later. And unfortunately, the diagnosis is not so good. And that patient actually is currently a patient at BC Cancer Agency. Now, the timeline here was unbelievable. And I sort of shudder to think what would have happened to this patient had they been in a different sort of a system. So that's the kind of difference we can make, and we do make every day.
Speed is definitely everything. When it comes to our health, there are a lot of things that can't wait, especially with, those type of issues like cancer or heart disease, whatever. When there's a gap between waiting times from seeing this doctor, waiting for this result, waiting for that doctor to call you back, and it's a busy healthcare system. Obviously, you've seen it a lot, and I know you've been involved in the telemedicine platforms for over a decade now. I saw from
Yes.
your
It's
so there,
exactly
so
it's
there
about 2 years
yeah.
now.
So there are probably personal reasons, and if you want to share any of those reasons, there are probably a lot of frustration coming from you as a physician that makes you interested in innovative platforms like this.
Yeah, I've always been interested in cutting edge technology. We've got AI now, which is a whole sort of another realm, and we can speak about that too. Um, but for me personally, the ease of which I can have a work day sitting at home as a physician it's very sweet. I don't have to commute. For years and years, I used to commute an hour and a half to 2 hours every day. And now I have a zero commute.
Yeah, you just turn the computer on and you can talk to as many people as possible. And I can tell
Right.
you from the other side of the computer, the patient, same thing. If there is a platform, which there is now, to open your, laptop, click a button, and somebody calls you within 2 hours, and I don't have to get in the car, I don't have to find the parking, I don't have to wait for hours. Who
You
does
don't have to you
that?
don't have to think about waiting rooms.
You don't have you, yeah, yeah.
Subject yourself to, we've got winter, fall and winter coming with viruses and what have you. You don't have to do that.
And the whole
Exactly.
experience of walking clinics, the whole experience of, yeah, as you said, sitting with a lot of sick people in the same waiting room, and you don't know how many hours you're waiting there.
Right. Right.
And then you're rushed. And then there's that question that I don't know how many times I've seen that now, which is unfortunate. One question only, and then you have to go back and come back for another question, whereas like you can just do it this easy with a click of a button. So this is
Right.
amazing that this is happening. And where do you see this going with AI?
Well, one of the things that the Avee platform is really good at is software. And so, two things. The big thing is AI is going to help um, improve doctor-patient interactions. It's going to help improve ease of access. It's going to help improve what doctors do when they see patients.
Mhm.
From a patient perspective, AI is very interesting because when patients come to me, many of them have already looked at AI, Chat GPT or Perplexity or whatever, wherever they go, and they've got a sort of fairly good idea of what's going on. They're not completely sure which direction they should head in. And so AI keeps physicians alert because patients are much better informed these days. And I personally think it's fantastic.
So do they come with a list of diagnosis?
Well,
And
they come with certain diagnoses and tests they want and ideas they have about how to manage their issues, and it's good. It's good.
wow, in such short time from COVID to now, I know there was a lot of resistance in virtual care, and then all of us were forced to use the virtual space. Do you have any kind of a number or idea on age group of the people that are using this platform already? How easy is it to use for the aging population, our parents? Because like right now, with having aging parents, a lot of us, I help my parents to find care. But if I could teach them that this is how easy it is and you can use it yourself, you don't have to deal with downloading the app or any complicated system.
Right.
Um, how do you see that from?
So that's a good question. The range of ages of our patients is from babies to octogenarians, nonagenarians. We have the full spectrum.
Mhm.
In terms of aging parents, I've got to be honest, most aging parents nowadays know how to access email and how to navigate a website. But having said that, for the few that don't, it's very easy for example, for you to go online and book an appointment on Avee platform for your parent, for your
Mhm.
mother, for your father. It's very easy. And then all they have to do is answer the phone.
I love it. I love how technology is making everything simpler. And I think if our parents can be on Facebook or social media, they can click a button too. And
Exactly.
it's just learning the simplicity and ease of use, I think, is everything, which I played around with it and I was very pleased how simple it was. I was happy that I didn't have to download anything and with just one big bright button that click here. And
Exactly.
that's it. So
Simplicity of use. Absolutely.
simplicity of use is everything. Yes. Now, you say every British Columbian can access Avee Health for free if you have MSP, medical service plan. What if you're visiting Vancouver and you don't have MSP? Is there a way that they can pay to access it? Is it still available to them? How does that work?
So if a visitor to British Columbia needs care, we do have a function where they can see a book an appointment, see a doctor, and pay a private fee.
Okay, so that's still available because
That is available.
a lot of us have visitors from out of town that they're afraid if something happens to them, how do we find a doctor?
Right,
Yeah.
right. So the key thing is they have to be physically present in British Columbia.
Mhm. And are there clinics that Avi is affiliated with in case you have to be physically examined, let's say, and you have to go to a clinic? Are there clinics like that currently?
So we are in the process of building that very specifically. We do have a clinic now in Surrey,
Mhm.
on the border of Surrey and Langley, that we've just opened up, and so we're just rolling that out.
Amazing. What are the average, um, we talked about wait times, but what are the average visit times with Abby?
That's a good question. So that depends on a physician's comfort in the way they run their practice.
Mhm.
So we don't have a specific sort of, we don't tell physicians how they should practice.
Mhm.
I can tell you that on average, a visit is between 5 and 10 minutes.
Okay, that's good. Sometimes it's shorter when you go to a walk-in clinic. It's like literally, I've been to walk-in clinics where the doctor is standing like on the doorway on their
Oh,
way out.
yeah,
And there's no blame. It's the crazy medical system when there's
yeah,
like 50 people waiting
yeah,
in
yeah,
waiting.
yeah.
Yeah, but there's no waiting room here, so it's a lot faster.
There's no waiting rooms. Exactly.
I love that. If you want to, did am I covering everything? Is there anything you want? Is there anything else you want to share with us about Avi?
Let's see. Um, you know, like everything in life, there is opportunity, and if you're the people who listen to you want to give us a try, I would say please go online, avee.health, www.avee.health, and give us a try. You know, we're growing, we're focused. We want you to have a simple, efficient, and happy experience with us. So give us a try.
And I want to ask you about future of Avi. Is it gonna stay in British Columbia, or is the vision to expand to Canada or maybe more? And also, is the vision to be just primary care, or are there going to be other practitioners on there? Like, where's the future?
Right, that's a great question. So we're exploring options to grow not only within British Columbia but outside of British Columbia. And we're also exploring options for allied medical healthcare, like, for example, potentially psychologists, etc. So we like to listen to our patients, and if there's sort of a theme that keeps on coming back, we start paying attention, and we'll make headway in that direction.
Amazing. If there's one thing you want British Columbians to know about Avee, what would it be? So I want you to leave everyone that are listening to this with something.
Well, I think in essence, we're already helping 1,000+ patients every day,
Mhm.
and we've got the ability, we've got the technology, and if you're struggling to find a physician, we can help you.
And that's all everybody needs to know. I talk to so many people that keep complaining about the crisis that we're all experiencing in British
Right.
Columbia, not having a family doctor or long wait times, and people getting misdiagnosis because it was too late or whatever. So when there are solutions like this that can help everyone, then it helps the whole community and everybody. So I'm super happy myself to see this as someone who's worked in healthcare for so many years, as someone who's been involved in startups, and making a digital platform for holistic health. That's different, but this is solving a crisis, and I'm super happy to see this. It was a pleasure to speak with you. And thank you for making the time to letting us know about this amazing platform. And I personally hope people that are listening to this go and check out Avee Health, because it's going to make your life so much simpler. And hopefully next time we see each other somewhere, there's less complaints about our medical system.
Well, we're definitely trying to make healthcare a little bit more accessible and simple. And patient by patient, we're changing it.
Amazing. Thank you so much.
Elia, thank you so much for the opportunity. Really appreciate it.
It was a pleasure. Thank you. Have a
All
great
the
day.
best.
Okay, thanks.